as I was a child, my Aunt Mary Margaret, who is my father's aunt, was a nurse, and she was a public health nurse. I'm from the Chicago area, and she was in Oak Park. And she was very sophisticated, and Mary, I just looked up to her because she seemed very smart, and the fact that she was a nurse, and she played classical music. I think that's what really got me interested in classical music. And I think that's what got me interested in nursing to begin with. When I was in high school, I was a nursing assistant at Oak Park Hospital, and I really enjoyed that. And I decided I wanted to be a nurse. And all through high school, that's what I planned on doing. I think my crowning achievement as a professional is acts of kindness and really helping people take care of themselves. And it's very funny because one of my first jobs out of nursing school was working with the Chicago public school system, and one of the jobs was working as a teacher for juniors and seniors in high school, and they wanted to be nurses, and they were in the inner city, and they didn't have a lot of support, number one, or background to be nurses, but I got them nursing assistant jobs, and I worked with them, and we had an open house at the school one day, and it was the emergency room, and it was the outpatient hospital, and they all really felt proud, and as it turns out, at least two of my 19 students became nurses. That was a real inspiration. And then the other thing was I worked as a teacher nurse in the inner city of Chicago, and it was with mothers and their children, and there was called ESEA Title I program, and these children were in small classrooms, and then their mothers were required to be in the parent mobile, and in the parent mobile there was a home ec person, and then there was me. And a lot of these kids had never been to a doctor, and so I connected with Rush Presbyterian St. Luke's Hospital and the nurse for the pediatric area, and I got the moms to take the children for care, and once we got the children taken care of, then I worked on getting the mothers care for themselves. And so in the parent mobile, it gave me the opportunity to teach them first aid and teach them about caring for their children and what to do in an emergency. Hopefully, I've been a role model for all my nieces and nephews. I have 8 brothers and sisters, and I forget how many nieces and nephews, but about 18. And now we have more children. Some of them have children. And I think one of the things that I have taught them is kindness, to really respect one another and to respect one another and to be sensitive to one another, and where it's possible to help. When I was in my 20s, when I worked at the child parent centers and at the high school, I had a person, Sandra Nye, who was an attorney and a therapist, who was an amazing person, who was a role model for me. I also had, when I started at Michael Reese Hospital, a person, Marion Simon, who was a philanthropist and who was an amazing woman who she drove me to work back and forth for 12 years, and we really got to know each other. And she was an amazing person. She just died a couple of years ago. And she was an amazing person. And also my boss at Michael Reese Hospital, Heidi Crooks, was also an inspiration because she did all kinds of work all over the world, and she gave me the inspiration to do that. So I did work, not only when I was working in the hospital, I went to China and spent time, but I also did work for the World Health Organization, and so I've been all over the world doing work for the world. Well, I think I'm the third oldest, so one of the things that I was responsible for was taking care of my younger brothers and sisters. But I think I think that my family has always been extremely supportive of me and the work that I've done. And I have to say, my mother and father, even with 9 children, they were so generous. My father was very involved with the Little Sisters of the Poor and St. Jude's. And then when I was in high school, I was down, my mother arranged this to the Marillac House to really work with kids who were underprivileged. So I think my family was very inspirational in teaching me how to help others who are less fortunate than you. My legacy, I've got 2 godchildren, two of my siblings' children, or my nephew's daughter. Hannah is my sister's daughter, and Maya is my nephew Jack's daughter. I hopefully have been a good role model for them. And one is just out of college, and the other one is in junior and high school. One of the most important lessons, I think, is to listen and to be kind. I think that it absolutely pays off to be kind to your fellow man, and where it's possible, to give them some inspiration to learn how to take care of themselves. And because that first work that I told you that was so important to me, that was my first work, and now I'm a patient advocate. And part of that work is very much the same, because as a patient advocate, you really help people have the strength to take care of themselves, and you research their lives and their medical history, and you can give them help, try to help them help themselves, or if they can't, you're there to help them. I'd like to be remembered as a person who is smart and who made the best of what my career entitled me to. In my work with the World Health Organization, and most recently I've worked with the Centers for Medicaid and Medicare, surveying hospitals all over the country. So I think that what I've taken is my nursing degree and made the most of it, and part of that is being a nurse is giving, and that feels the best to me.